Welcome back. We continue our conversation with Dr. Barbara Ferrer. We asked for questions from all of our viewers on Twitter. By far, the most amount of questions were about your resume. So we want to be fair, let you address it head on. You have a PhD in social welfare, a Master of Arts in public health, and a Master of Arts in education. How do you respond to people who say it's inappropriate, you call yourself a doctor, and people that say that an epidemiologist or an MD should be in your role for the county?
Yeah, thanks. It's such a good question, and appreciate the continued interest. Obviously, you know, the first thing to note is at the Public Health Department, we have a significantly qualified leadership team, and we bring many different people together, epidemiologists, physicians that are specialized in infectious disease. And I do bring a unique set of credentials. I think sometimes people look at, you have a PhD in social welfare policy, what does that mean? I was actually a Pew Fellow with a dedicated both funding source and a deeply enriched program around health policy and public health. And it was a special program, recruited people from across the country that really stayed focused. And it was a program that actually was done in partnership with BU School of Public Health and with Brandeis University. So there was a dedicated group of us that worked together for a couple of years, did all of our coursework with a very dedicated focus on public health and health policy. So I know the degree looks like it came from a wider university-wide program, but the actual focus of the work that I did was part of a funded program with the Pew Foundation to really develop health policy leaders across the country. And, you know, I always appreciate that there's a whole different set of skills that everyone is bringing to this work. I do have years of running a public health department in Boston, a fairly significant city, with a really, again, amazing set of staff that led a lot of really exciting efforts there to improve the health and well-being of all of the residents. And I think we're really been dedicated here to do the same.
And a follow-up to that, and just on a personal note here, I mean, you've become a very familiar face since March of 2020. And you went from really sort of like the healthcare darling to literally getting death threats, which is just unbelievable. How have you handled and reconciled that?
Look, you know, jobs have been tough for everybody this year, and I think they've been toughest for the people who lost their jobs. So I actually feel very blessed. I still have a job. I work with a wonderful group of people. And yes, there's been a lot of anger over the past year, and sometimes, you know, it's you know, really been directed at me personally. But there's also been a lot of people who have shared a lot of support for us and our team here. And we get letters every day from people across the county thanking us for the work that we're doing. So, you know, I think this is the job. It's been a really challenging year, devastating in so many ways for so many people, and we're doing our best. And I think our job in public health is really very clear. You know, we want to make sure that people don't get really sick and they don't die from COVID-19.
Well, let's reflect a little bit more on that year, because hindsight, of course, is always 20/20, but it's important to learn from the past so that we don't make those same mistakes again. What would you say is the biggest mistake that LA County Health has made in the past year with time now to reflect?
It's such an important question, and we obviously do a lot of reflection here and have all along. You know, I think mistakes are a hard word and a harsh word. Because what we know now is very different from what we knew when we started. But the one area where I wish we had been more attentive early on is around making sure that we were acknowledging that, as with so many other diseases, there was the potential for COVID-19 to hit Black and Brown communities much harder than it was going to be affect other communities, particularly communities that were better resourced. And I wish, you know, at the very beginning, we had been thoughtful about understanding when everybody did go home, that those workers who weren't able to go home, our essential workers, were going to be at a lot more risk. And we had introduced earlier on both, access to resources for those workers, started really focusing on getting more testing to those workers, because I think that's where we might have been able to really not have seen such steep increases and so much disproportionality in cases, hospitalizations, and deaths. And I wish we had paid a lot more attention to that issue early on. Remember at the very beginning, this was really thought of as a pandemic where people were getting sick who were travelers. And we should have realized right away that it was not going to stay in the communities of people who were just traveling, and it was going to spread very quickly amongst essential workers.